Doctors, nurses, what was the most how the FCK are you not dead patient you dealt with? He came in almost like a walking nightmare, a scene straight out of some gruesome movie. The guy had been in a road accident, one of those brutal crashes where you expect the worst before they even get him through the door. When I first saw him, I couldn't believe he was alive. His wounds were catastrophic, flesh ripped open so deep his intestines were literally hanging out. Not just a little tear. His guts were exposed, slick and vulnerable. Around 40% of his face was scraped off, like someone had taken a cheese grater to him. One eye was completely dislodged from its socket, just dangling there. And his right forearm, the muscles were torn away from the bone, leaving it bare and bleeding. Despite all that, the bleeding had somehow stopped. There was this eerie stillness, like his body was holding on by a thread, refusing to give in. When I walked into the trauma bay, I saw his chest rising and falling with ragged breaths, and he was clutching his intestines to his abdomen. Alive, somehow. That was the moment you realize how fragile life can be, and how much guts it takes to hold on. The team jumped into action. Every second counted. The first priority was stopping any more bleeding and preventing infection. We started cleaning, irrigating the wounds, and preparing him for surgery. The operating room was intense. Hours of stitching, repairing, and reconstructing. The surgeons worked on his face, trying to piece back what had been shredded. It was like a puzzle made of flesh and bone. The eye had to be carefully removed to prevent infection, but every effort was made to preserve function where possible. The forearm muscles were repaired and wrapped to protect the exposed bone. It wasn't just about saving him physically, it was about fighting for a future, for a chance at something resembling normal life. Over the following weeks, he pulled through. Complications cropped up, as expected with injuries that severe, but he kept fighting. Physical therapy was grueling, especially for his arm and facial muscles. The scars were deep and permanent, but so was his spirit. Months later, he was walking again, talking, laughing even. The face reconstruction wasn't perfect, but it was a testament to how far medicine and determination can go. His eye was gone, but the rest of him was there, alive and well. That kind of survival isn't just about luck or skill. It's about a will to live that refuses to quit, even when everything looks lost. And seeing him come back from the edge like that, it's the reason we do this job.